you believe that often you don't need to go to a hospital to get a correct diagnosis? The smell of your body can say about your health and illness just as much as very sophisticated diagnostic instruments. You just need to be able to smell. This story appeared on the pages of National Geographic and BBC several years ago. Scottish nurse Joy Milne was happily married, and one day she noticed that the scent of her beloved husband began to change gradually. Firstly, she didn't pay much attention to that until 6 years later her husband was diagnosed with Parkinson's disease. Joy accompanied her husband to the hospital to participate in support group, and once entering the room where Parkinson's patients and their relatives gathered, Joy was struck by a very strong but familiar scent. It was the smell of Parkinson's disease itself. It was the smell she once noticed on her husband. By the end of the meeting, Joy could unmistakably recognize which person in the room had Parkinson's disease, which one was healthy. Joy shared her observation with the doctor, and the doctor was intrigued and suggested to perform a blind experiment. 6 volunteers with Parkinson's disease and 6 healthy volunteers were given identical t-shirts. They wore these t-shirts during the day, and at the end of the day, these t-shirts were given to Joy to smell. Joy correctly identified all 6 t-shirts and 5 of 6 healthy t-shirts. 1 healthy t-shirt was assigned by Joy to sick category. Anyway, 11 of 12 correct answers is a very good result, and all the researchers congratulated Joy with the success. But can you imagine how surprised they were when, after 8 months later, Parkinson's disease was diagnosed in a man whose t-shirt Joy wrongly identified as a sick t-shirt. That meant that Joy could detect the first sign of disease long before the first symptoms appeared. The connection between disease and the smell was noted by ancient Greek and Indian doctors. They suggested to use the nose to make a diagnosis. With diabetes, the smell of acetone is caught in the exhaled air. Liver failure gives the body the smell of raw fish. The typhoid fever gives the smell of baked bread, and yellow fever makes the skin smell like a butcher's shop. But not everyone has as incredible nose as Joy Milne. But animals are much better sniffers than humans are, and they can identify the very tiny shades in the smell. For example, moles are among the most sensitive sniffers, and they can smell not only on the surface but underwater. Shark can smell 1 drop of blood in the body of water as large as Olympic pool. An albatross can smell the food 20 kilometers away. And even snakes are much better sniffers than humans are. Scent molecules stick to its tongue, and the snake transfers it to sensory center. But you will agree with me that our 4-legged friends, dogs, are amazing sniffers. Dogs can help us to find lost things and lost people, to follow the criminals, and to detect firearms, drugs, and explosives. And it was shown recently that dogs can work very well in detecting diseases. For example, there is a special service called Diabetes Alert Dogs, where dogs are trained to detect specific odor of low and high level of sugar in blood of their owners. It appears that dogs are very sensitive to very tiny changes in sugar level and can detect it well before these changes become dangerous. Visit this site and you will read dozens of stories about how dogs saved the lives of their owners. But diabetes is not the only disease dogs can recognize. During last 15 years, several experiments have been published which demonstrated how dogs can recognize various kinds of cancers by the smell of urine and exhaled air. Here you can see the design of double-blind experiments, and it was shown that the sensitivity of dog's nose is at least as high as sensitivity of the most modern instruments used for diagnostics. It was shown recently that dogs can identify persons infected by COVID-19 among the crowd in the international airport. And the accuracy and sensitivity of dog's nose in this test was at least as good as sensitivity of PCR test. But can you imagine how to do PCR test for thousands of passengers in the international airport? Dogs can do it easily. Not only dogs can recognize diseases, mice are not far behind the dogs. In this experiment, mice are placed into Y-shaped maze, and in one arm the urine of healthy volunteer is placed, and in another arm the urine of cancer patient. Given a choice, mice run toward healthy volunteers' urine. A very interesting diagnostic system was suggested by Japanese scientists. C. elegans. This is close relatives of roundworm parasitizing in human and mammal bodies. And C. elegans, unlike mice, they move toward the urine of cancer patients. So, well, everyone has their own preferences, but sensitivity of nematode in this test was amazing. It was more than 95%, despite the fact that most of the patients were in the earlier stages of the disease. Human's nose is not as good as dog's one, but human can invent various types of machine. So can we invent machines to detect smell? It is not very easy at task, because the smell of human body is determined by thousands of volatile organic compounds. And concentration of these compounds is very low, so our devices should be very, very sensitive. But the main problem is that not all of these compounds are connected with disease. Human odor reflects many factors such as age, gender, food, medication taken, physical exercise, environment, and even mood. And it is a really challenging task to identify one or several compounds which are reliably associated with disease. Nevertheless, some success is already in clinic. So, for example, there are several breath tests which have been approved by FDA. First of them is exhaled nitric oxide test that measure inflammation caused by asthma and some other diseases. Helicobacter pylori breath test determines the presence of this harmful bacteria, which is the main cause of ulcer. Gastric emptying breath test is a test that helps to recognize gastroparesis or delayed emptying of gastric. Heart's breath test detects the early signs of heart rejection in patients after the heart transplantation. There are two various approaches. How can we measure smell? Electronic nose and gas chromatography. Electronic nose mimics the nose of human or nose of animal. In our nose, there are dozens of receptors which interact with volatile organic compounds. Similar to that, electronic nose contains a number of sensors, and each sensor can interact not only with one compound, but with various volatile organic compounds in a competitive way. Vice versa, each compound can interact not only with one sensor, but with several sensors, with various affinity. So electronic nose doesn't identify or separate compounds. As a result, we obtain the image of smell, and we can compare this image with other image or with reference image in our library. Unlike that, gas chromatography separates all compounds using chromatographic column. And as a result, we obtain characteristic pattern chromatogram which contains a number of peaks, and each peak corresponds to one compound. And then these peaks can be analyzed by mass spectrometry. Both of these methods are good, and both of them can be used in practice. But which one to choose depends on the task we have in our hands. Electronic nose is quite cheap and simple method. It can be used on site. Gas chromatography requires expensive and very sophisticated equipment, so we can use it only in specialized laboratories. But it is more precise, and we can use it usually when we need to follow how treatment influences the disease. So let's compare the ability of dog's nose and electronic nose to detect the disease. In this table, you can see how both of these noses can recognize cancers, various kinds of cancers. And you can see here that dog's nose is at least as good as electronic one. What about dog's nose versus sophisticated mass spectrometry? You can see here that in many respects, dog's nose is not worse than mass spectrometry. Well, so while reliable equipment is being developed, doctors can use their own nose and the nose of our whole lab assistants to make diagnostics.